Medical assistant is caring for a patient who just fainted. Which of the following is the appropriate first response? So option A says offer the patient a drink of water, and maybe eventually while the patient's recovering, we would consider this, but it's saying that the patient just fainted. So you might want to think there might be something better that would be a better step to do immediately after the patient just faints. And also, depending on what the situation is surrounding this, if it's something really serious that caused the fainting, if it's not just, oh, they were really scared and fainted, if there's actually like a medical, something that's going on and maybe they're going to be sent to the emergency room, they might possibly need a procedure done and you might not want to give them food and water. So we might want to just hold off on that for right now. So let's eliminate it for now and let's look at the other choices. Option B says to elevate the patient's legs, and that is a good thing to do if a patient faints or is starting to feel faint, because usually the response that would cause a patient to faint by lifting their legs up, so let's say a patient's like lying down, and we lift the legs up, it sends the blood flow back to the brain to give more oxygen to allow them to start to feel better and come out of whatever made them lose consciousness. So that would be a good option to go with. So we'll go with option B, but let's continue along here. Option C says begin chest compressions, and that is definitely no, you don't want to do that because that would be like performing CPR. That's what you do when a patient not loses consciousness but no longer has a heart beating. That would be option 1, so no heartbeat, no pulse, and not breathing. This patient, if it's just that they passed out, they will still be breathing, they will still have a heartbeat, and that would be very startling to them. And for that reason, that's why when you initiate CPR, the first step that you learn is check for breathing, check for pulse, try and tap the patient and see, are you okay, to try and get them up first before you just jump to the chest compressions. And then option D here says to apply a cold compress to the patient's forehead, and that wouldn't really be necessary for this situation, so we could eliminate option D. And that leaves us with option B, elevating the patient's leg for this situation of just fainting.